Hello, and welcome back to Live Well and Prosper. Today, we're going to delve into the critical topic of colorectal cancer screening, also known as CRC screening. CRC is the third most common cancer worldwide, and it affects both men and women. And according to the latest statistics, the lifetime risk of developing CRC is about 1 in 23 for men and 1 in 25 for women. So it is a fairly common cancer. Colorectal cancer affects the colon and/or rectum. It primarily affects individuals age 50 or older, but it can occur in younger individuals as well. The disease can take many years to develop. Typically, they start off as small polyps lining the colon or rectum. And remember, not all polyps become cancer, but detecting and removing them early can prevent the progression to cancer. You want to think about colon polyps like weeds in your garden. You want to pull those weeds out when they're still small at a young age before they turn into large weeds that are harder to manage. Once they become too large, it requires large tools to remove those weeds, and sometimes you can disturb the garden surrounding these weeds. The same thing happens to colon polyps that progress to colon cancer. You want to get them when they're still small. Given these statistics, it's so important to screen for CRC starting at age 45 for those with an average risk. So this includes people who don't have a family history of colon cancer or who have certain types of polyps. And it also doesn't include people who have a personal history of inflammatory bowel disease, which includes ulcerative colitis and Crohn's disease. If you are at a higher risk, you might need to begin screening before age 45 and have the screening performed more often. Usually the process of screening ends at age 75. However, as we all know, there are people who live well beyond those years, and if they have a 10-year health horizon to look forward to that includes a good quality of life, exceptions can be made for those healthy individuals. Now let's delve into the types of screening tests available. Basically, there are two categories that we need to think about. There are the stool-based tests, and then there's the direct visualization test, and let's go over both of those categories. Stool-based tests include the guaiac-based fecal occult blood test, as well as the FIT test. Both of these tests are designed to look for microscopic blood in the stool specimen. There is also another stool test which is looking for the DNA of colon cancer in the stool specimen, and this is called the FIT DNA test. Currently, this is being marketed as the Cologuard screening test. When either of these tests are positive, this could be a sign of cancer. It doesn't necessarily mean that there is cancer, it only suggests that it might be there. Direct visualization tests include colonoscopy, CT colonography, and flexible sigmoidoscopy. Of all these tests, the colonoscopy is considered the gold standard because it allows for examination of the entire colon and the removal of polyps if they're encountered during the procedure. So how do you decide which test is right for you? Well, that's a conversation you should have with your healthcare provider. The choice of a screening test depends on your individual preference, the likelihood of that test leading to early detection and prevention of cancer, and of course, the potential harms of the test. The most important thing you have to remember is the best screening test is the one that you choose and get done. Regular screening is important since early detection can save your life. So what happens when a non-colonoscopy screening test is abnormal? The most important thing is that a colonoscopy is then performed next. This diagnostic colonoscopy is recommended to be performed within 3 months to prevent that preclinical lesion from developing into a less curable stage of colon cancer because of a diagnostic delay. Once an abnormal screening test is followed up with a colonoscopy and the colonoscopy is normal, you can then return to a regular screening schedule. So in conclusion, colorectal cancer screening is a vital tool in the early detection and prevention of colorectal cancer. Remember, the most important thing you have to do is have a dialogue with your doctor and understand all your options, and choose the test that best fits your situation and your comfort level. Remember, the best screening test is the one that you choose and the one that you get done. Any of the tests that we have discussed is better than no screening at all. Thank you again for tuning in, and for more information, please refer to the various society guideline links below in the description. And as always, stay informed and stay healthy. If you found this video helpful, give it a thumbs up and don't forget to subscribe to our channel for more health-related content. And if you have any questions or topics you'd like us to cover, please drop them in the comment section below. See you in the next video.